Anatomy is one of the most feared subjects by students in BDS first year. But let me tell you one thing, it's not as scary as it seems, especially when you know where to focus as a dental student. So hello everyone, welcome back to the channel. So today in this video, I Ariba Parvez, a second year dental student, will break down how exactly you need to study anatomy as a BDS first year student.
Rolling and action.
Now, the first question that comes into everyone's mind is why anatomy is important for dentistry or dentists. Why is it important and why are we even studying it? So, the first and the foremost thing is that anatomy plays a great role in your dentistry, because if you don't know about your own body, how can you even expect that you can do the RCTs, the extractions, when you don't even know the anatomy of your body? You need to know the relevance of anatomy in dentistry, the head and neck part, the cranial nerves, the muscles, the blood supply, everything in detail. Remember one thing, that you don't need to mug up everything. It's about dental focused anatomy. You need to be focused on dental part, that is head and neck. This question comes a lot, that anatomy is so vast that we learn and then we forget. So let me clear you this thing. It happens with everyone and it has happened with everyone. So how to deal with this? Like, we learn and then we forget the other day or within a week or like in the exam. The first thing is that make a short notes notebook. Like, when you study this subject, you get to know that what are the important questions, and your teacher tells you the past year questions reveals that these are the important questions. So make a separate notebook of it and keep on revising from that particular notebook, because that will help you at the time of your final examinations. And if you're not able to remember the stuffs of anatomy, because yes, anatomy is vast subject, so the only thing that you can do is that just read a particular part. Like, if you want to learn about the cranial nerves, read it. Or like, cranial nerves are the important cranial nerves are like 4 or 5 of them, which are particularly asked in exam every time. So make a table format, make some tricks for yourself that you can remember. Make tables and charts for yourself, like the muscles, their action, nerve supply. Make a full chart and paste it in your room. You will definitely learn them at, like, if you start it from earlier, you will be able to do it in your final examinations. The last thing about theory is that just give yourself 30 minutes, half an hour a day. Like, especially for diagrams, the notebook that you have made, or maybe you haven't made, just go through the textbook, go through the diagrams, and keep that in your mind every day. 30 minutes is enough for anatomy, especially for the diagrams, because at the end the examiner will only give you marks for your diagrams if your answer has diagrams and theory as well. Out of 10, like out of 10 you can get around 8, 8.5, because, like, see, 1 marks is definitely deducted, because there is always a scope of improvement in dental colleges or medical colleges. So now let me tell you about the practical parts. Now, the practical thing is that in the dissection hall, stay focused, because sometimes you just remember the particular thing that you have seen at the time of your classes, and at the vivas and everything at the end, everything, the dissection part becomes a headache, especially the dissection part. So stay focused in your dissection halls. Don't just go for gossiping and all with your friends. Just stay focused. Each and every part, everything is should must be clear, because the examiner might directly ask you what is this and you won't be able to answer then. Now, if I tell you about the foramens, the normas, stay focused in that as well. Keep on revising it at the time of your practical classes. Like before you are going to your practical classes, revise the particular norma that was done in the previous class. That would help you because foramens is the particular thing that would be asked by your examiner. It is the most important part of your viva. And don't get scared what your seniors have told you, like anatomy is impossible and everything. Don't get scared by that. Yes, anatomy is vast and difficult, but it's not impossible at all. Stay focused on the head and neck part, histology, and embryology part. You would be able to score well in anatomy, and you would actually be able to understand dentistry better. If this video was helpful by any chance, do drop your doubts in the comment section. I'll try to answer it, and also I'll try to make more such subject wise guides for you all. Also, if you want some personal doubt clarification, you can also contact me through Instagram or Telegram. On Telegram, I have few PDFs of important topics of anatomy and other subject as well. You can join that channel as well. So that's it for the video. Bye bye.